Okay, lovely. So Tara, first of all, thank you so much for joining us today. You're number 4 in our series of practice manager interviews. So thank you very much for joining us all. A bit of background just by way of introduction. So Tara, you and I go way back. So you were my practice manager and managing both me, my brother, and my dad at exactly the same time. So I think the United Nations, if general practice doesn't work out, United Nations definitely might work. But you're an exceptional talent. It's been a pleasure working with you in the past, and it's a privilege to have you on today. So you are the practice manager at Galway Primary Care, and thanks so much for your time.
Thanks for having me. Yes, I go in primary care for 12 years now, Sean, which is hard to believe. It's that long.
Wow. Yeah, God. I was thinking in my head it was 6 or 7, but God, 12 years. So big changes, that's for sure. So Tara, so can you tell us a little bit about the practice in Galway? Just like,
Certainly. Lots of
urban,
changes.
rural, exactly. Just a bit of background in terms of the practice.
Yeah, so we're an urban practice in Galway with 2 clinics, 2 locations, kind of a team of 18 spread across 2 sites. We've 6 GP, 4 nurses, and some clinical assistants and admin. And I suppose our core value as a practice is teamwork. We're very much a team, and we value our receptionists as much as we value our clinical team. They're the kind of first point of contact for the patient. So we try and have that as our core value in the practice, that we all work as a team and kind of enjoy helping the patients with their journey through the practice.
Brilliant. So Tara, that's a big team, and the interesting role there is the clinical assistant. Can you tell us a bit more about that role, or what that kind of member of the team does, or how it fits in?
Yeah, I mean, obviously it's a new role within general practice. It's just kind of begun in the last couple of months, but it really just helps our doctors, our clinical assistants can do some baselines for the patients, help out with kind of some phlebotomy services and that. And really, we try and kind of optimize our resources so that everybody is doing what they should be doing with their time, so that the doctors are free to kind of see the patients, and we try and support them as much as we can in order to free them up to be available to see the patients that need to be seen.
So it's a really interesting role, and I think there's a lot of practices looking to hire for that now. How did you find someone to put in that role? Did you train them up from another role, or did you advertise externally?
Yeah, no, it was kind of within the practice. We kind of developed it within the practice. So we had some team members that had some experience kind of as like healthcare assistants and phlebotomy, and that we found it very beneficial within the practice. But it is an evolving role, and I suppose that it'll become a lot more in the future, hopefully, because obviously we all know GPs are in high demand and there's not enough to go around. So we definitely we want to try and support them as much as we can.
And Tara, the last question on that role is, are you seeing an impact already in terms of that role, in terms of does it help more on the admin side, or the practice nurse side, or the GP side in terms of time? Or is it too early to tell yet?
I suppose probably from a nursing point of view, it helps. Obviously CDMs is a huge part of general practice now, and that is quite time heavy for the nurses. So freeing them up to kind of manage the CDMs definitely helps. I mean, CDMs are a huge part of what we do. But we're also mindful that they can't become the be all and end all of general practice. There are lots of other services that we have to do on a daily basis. So we have to try and manage everything so that we're available to provide all of the services within general practice, and that it doesn't become too CDM heavy. So we try and just kind of, I suppose we're always analyzing, appointments and kind of the timeline of appointments and what's working and what's not working. And we're always adapting things, and things are always changing in general practice. I mean, every practice will know that no 2 days are ever really the same. And you kind of I suppose you kind of try something out, maybe it works, maybe you have to tweak it a little bit, and then you kind of just go from there, and you kind of figure things out as you go along as well. There isn't really a rule book that we kind of follow. We kind of, because every practice does something a bit differently, so we just have to adapt it kind of to what works for us as well, and works for our patients and for our team.
Well said, and well summarised, Tara. Can I ask, in terms of CDM, which is a mammoth, like it's just a beast for a lot of practices to get their arms around, are there things and maybe you had it all figured out at the beginning, but are there things you now know about CDM you wish you knew when you started? Or are there any learnings you've got from doing the CDM journey?
Oh, absolutely. The CDM is always changing. We have ran it one way, we've looked at it, that hasn't worked, we've tweaked it. And it's really just to find that sweet spot between, I suppose, inviting patients in for their CDMs and making sure that we're available to see the patients who need to be seen when they're actually sick. And it's just to really find that kind of sweet spot. But also kind of educating patients. We have found, I suppose at the beginning, patients didn't understand what CDM was and what that language is. Like now they're becoming a lot more familiar with, oh, I get my checkup every twice a year. They kind of know when it's due. And that's definitely helped that they're a bit more familiar with the program as well, I suppose.
And Tara, is that just down to them getting familiar with it, or have you changed the way you kind of explain it to them, or is it around the patient messaging, or do you know what I mean? I'm just, because I presume they probably get more familiar over time, but have you changed tact in terms of how you explain it to them, or just?
Yeah, we do. Like it's just the language that you kind of use, even when we're booking them in. Your checkup is due, or maybe patients contacting us. We just say, "Oh, your bloods are actually not due until whatever month it is." So just so that they're a bit more kind of clued in to how we can look after them, I suppose. So it's kind of just the language that we would use with the patients. And we do try and educate patients as well, just like we want to be available to see you when you need to be seen. And that patients are managed, that they are able to access us when they need to, but also that they're not accessing us unnecessarily. That we
It's
can manage them and manage their expectations of the whole thing. And especially around the blood test, I suppose the bloods has been a huge part of it, that they kind of know when they get their bloods, because we're all used to the patients, oh, I just want to get my bloods, but why? What does that mean? That's it's not as straightforward as just a blood test. So we've just kind of tried to kind of use different language with the patient and just educate them, I suppose, around what it means. We have a great nursing team, and they really communicate well with the patients. We've tweaked things from booking the bloods in beforehand or bring them back for their GP review. We're always tweaking that, and sometimes it's not one rule fits all. Sometimes you kind of just have to, if we have elderly patients, we'll try and accommodate them in a way that's manageable for them as well. Because at the end of the day, it's not just about us; it's about the patient.
So it sounds like the secret for your CDM working well, Tara, is your willingness to kind of change and adapt it over time. It kind of sounds like it's your willingness to change and adapt it over time that makes it work. That you're willing to tweak it for a patient, or if something's not working, you'll throw it out and do something different. So it's probably good
Yeah,
advice.
I mean, you can't be too rigid, I think. Yeah.
So just to move away from, because CDM we could talk about for probably 2 hours. How do you find the role of PM, Tara? Because like your role's just gotten bigger and bigger as the practice has gotten bigger over the last couple of years as well. So like, do you like being a PM? What do you like about it? What are the challenges that you face in that role? And what would you recommend for people that are thinking about becoming a PM?
Yeah, I mean, I do like the role. I mean, it's challenging. Maybe I like a challenge. The role of a practice manager, you wear many hats. Your HR, your patients, your finance. There's a lot of aspects to the role. I think if you work well with people, I think it's a good role to to look for or to go into. And if you're kind of comfortable with challenges and being able to adapt, and you kind of have to be able to work off your own initiative, because sometimes you are kind of left to your own devices to figure things out. Or I also try and engage with the staff, because like I started in reception, so which I do feel is a very valuable place to start, because you know the working of the practice from the very basics right up to, meeting with the partners of the practice and all the other aspects that come with that. So really getting to know all the aspects within the practice definitely helps. Um, but I guess it's challenging. It's enjoyable. No 2 days are ever the same. Some days we're firefighting, and other days you do get to sit down and kind of put your head down and kind of do the day-to-day practice management tasks. I think we're moving away from the firefighting a bit more and into kind of the actual management of the practice. Suppose when I started, I was probably more of an admin manager than a practice manager, and actual practice operations, business management. It's evolving from kind of just managing the day to day administration of the practice. And I mean, the GPs are incredibly busy, and if it frees them up to see patients, or their administration to look after patients is increasing all of the time as well. So I think they need to be freed up to kind of focus on that.
Brilliant. And would you recommend her? Is there any good courses? Is there any good, educational seminars or workshops or things that you've done over the last year or two that you'd recommend? Rachel's one comes to mind, because I think you were part of that.
Absolutely.
I'm giving you the plug, but would you recommend that, or are there similar ones?
Yes, absolutely. I suppose we're lucky as practice managers to have GP Practice Ally as a resource for us. I recently completed the course, the first group of the course, and I would highly recommend it, because it really just builds your confidence, and it shows that a lot of practices are coming up against the same issues. You can kind of put your heads together, put a plan in place, and just bounce ideas off people, because sometimes you're within your own practice, it might be a sensitive issue or that, and you just have somebody else to kind of bounce things off as well, which is really helpful. So we are very lucky to have that, and I would definitely recommend doing the course with GP Practice Ally. I have found it very beneficial.
Was it a long course, Tara? How long was it? How long is the
It
course
was over
for?
12 weeks, so it was around over 12 weeks, and it's an in-person course, which is really beneficial as well. So we traveled to Port to do the course, and we all sat in a room together, and it was just lovely, because we all got to communicate, and um, we really kind of became a group, and I think we'll be friends for life now based on that. And it's nice to just have that kind of as as a community really within the practice managers.
Oh, that's brilliant. And are you going to go to the conference next weekend? I think. Are you going to head to that, Tara? Are you down
Yeah,
in
hopefully
Northeast?
we'll head down. And yeah, I mean it's a really good, because before that, like what we had as practice managers was very limited, and sometimes we were reading between the lines of maybe what might be communicated from the doctors, from the patients, from the admin team, and you're kind of trying to find, what's practical. Okay, we need to do this, but is it practical? How do we do it? And then actually implement it. So you kind of have another kind of resource to go to now. And also sometimes it's been quite difficult to get information or, updates. So remember in COVID, things would change on the hour, and you'd be kind of figuring it out on the day. So we definitely have another outlet there that's been very helpful.
That's Tara. That's brilliant. And before we wrap up, so final question. Well, first of all, is there any big challenges that you're currently trying to manage at the moment from an administration point of view, or is it just the general life, the general practice and patients? Any particular ones you're finding challenging currently?
I definitely like one of my bugbears is DNAs and these kind of things, and it's like we're looking at ways that we can manage that. We've introduced a couple of things, and sometimes you have to tackle an issue from a few different angles. There isn't like a quick fix. You kind of have to look at it from a few different angles. So we're trying to manage maybe our DNAs, and making sure, because that impacts access for other patients. And, we're constantly, most practices are getting requests every day looking for patients to join the practice, patients seeking GPs. And it's really just reviewing that and making sure that we're able to provide a service, and also dealing with patients' expectations, and being able to manage them as best as the DNA's down. But we're getting there slowly but surely. And sometimes we just have to kind of tackle one thing at a time, because we can get into a bit of a habit of trying to fix everything all at once, and then nothing actually works. So we just have to take one thing at a time and kind of do it properly. Yeah.
Eat that GP practice elephant one bite at a time, that's for sure. But it sounds like it's tracking all the right direction for you. Tara, thank you so much for your time today. Hopefully I'll see you at the weekend. It's been brilliant to chat to you, and I learn something new every time we talk. So thank you again for your time. Really appreciate it.
No problem. Thanks for having me.